And according to the National Council for Mental Well-Being, mental health services in the U.S. are insufficient despite more than half of Americans seeking help. Even as the country destigmatizes mental health, limited options and long waits are the norm until Ellie Mental Health Town and Country. The clinic has made it their goal to break down these barriers for the communities they serve and give everyone a place to turn to. Take a look.
So again, during the pandemic, I pride myself on being a self-sufficient, very happy person, and I couldn't even tell when I was depressed. I had to figure it out and become introspective. I was working a lot because, you know, the world needed us. That's what they said. They were banging pots. They needed us. I was working, saving lives and seeing more trauma than I'd ever seen in all my 15 years. I became depressed. I knew that because I wanted to commit suicide every day for months. I would think about jumping from the Blanchette Bridge, which is the way I get to work. I didn't seek help until one of my colleagues committed suicide. And it's hard to admit you have a problem. It's hard to take that first step. And it was even harder to find someone who could help me.
Introducing Dr. Pamela Buchanan.
And if it's that difficult for me as a physician, it must be 10 times more difficult for the everyday person. So I wanted to be part of the solution because there's a big problem.
And her solution? Welcome to Ellie Mental Health Town and Country. Dr. Buchanan brought the first Ellie clinic to Missouri. Ellie strives to make mental health care the norm, providing people of all backgrounds accessibility to services.
We're a full spectrum of mental health here at Town and Country, so our therapists have multiple modalities, some of them through cognitive behavioral therapy. We have someone who does EMDR. I am a physician. I do medication management, treating ADHD, anxiety, depression, and we also have a child therapist, and they do play therapy.
This space is a place for people to talk, decompress, and heal. Yet their impact goes beyond their services, but directly in the community too. The clinic is developing groups for the LGBTQ community, loneliness groups for the elderly, or even spaces for healthcare workers.
And you can see that it's taking a toll. The mass exodus of nurses and doctors right now is because our mental health is not a priority, and it should be. I'm a physician. I worked in the pandemic. Some days, 2 or more people would die during the pandemic. It stressed me. It made me sad. But I was not mandated to go to therapy. I should have been.
And above all, they strive for diversity in the workforce.
We believe that to have cultural competency, people need to see themselves within their therapists. And that means having all types of people from various backgrounds, orientations, religions.
Because here at Ellie, everyone has the right to mental health care.
We strive to help those that are marginalized, so people who have lower socioeconomic status. And I think that is something that's different and needed in the healthcare community. A lot of young minority youth may be mislabeled as behavioral problems when they truly have a mental health problem or a learning disability, wherein a lot of young people will be deemed juvenile delinquents when really they have a mental health issue. So it's important, I think it is tantamount to get them tested and then appropriately treated.
Medicaid and Medicare are accepted, as well as many major insurances. With no wait list, get help now. Book today at Ellie Mental Health Town and Country. I had a wonderful afternoon with Dr. Buchanan, truly making a difference of mental health right here in the St. Louis community. So plan your visit, Ellie Mental Health Town and Country. There's all of their information right there on your screen. And there's no wait list. Right now, you could call today and get the help that you need.